everyone. A very good evening to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing really good. Hair loss, whether it is hair loss in men or hair loss in women, is a common biological problem all over the world, not just in India. The importance of hair in enhancing the overall personality of a human being cannot be underestimated. Hair is the first thing that people normally notices about you. A great hairstyle can give you the personality boost you require in doing well in both personal and professional fronts. Hair loss, on the other hand, can prove to be a real disadvantage for many people. Many young boys and girls start losing their hair early in life, caused by a variety of genetic, environmental, and systemic factors. Hair fall can affect everyone regardless of their country of origin, but thankfully, effective hair treatment can control and even reverse the hair loss process. So today, please join me in extending a warm welcome to expert Dr. Mriganka Mehra, consultant dermatologist and dermatosurgeon from Delhi, to make us aware on hair fall and its management. Dr. Mehra, MBBS, MD in dermatology, mineralogy, and leprology, is a dedicated dermatologist with over 7 years of experience in this field. She currently practices at Imara Skin Clinic in Krishnanagar, Delhi. A very warm welcome to you, Doctor.
Thank you so much for having me here today.
It's such a pleasure actually to have you with us today because hair loss is so common, and most of the time people will keep wondering why we are losing so many hairs. So, why hair loss happens, Doctor?
Okay, so see, this is one question which does not have a simple answer. Okay,
Mhm.
hair loss, I can't tell you there are 10 causes, find your cause. No, I'll start with two basic common causes, and but causes can be, hundreds. So the two commonest which we see, one is something we call hormonal or genetic hair thinning or patterned hair thinning, which usually starts maybe in 30s, 40s, sometimes earlier also. And the second very common type is the telogen effluvium type. In simple language, that is stress related hair fall. Okay, so any kind of stress on the body, you've had a surgery, you've had an illness, you've delivered a baby, you've had some sort of a mental stress or some nutritional deficiency, that's going to manifest as hair fall, right? So but the good news is this kind of hair fall is usually self-limiting. It improves with correct treatment or sometimes even without treatment. Then there are so many other causes. Sometimes medicines cause hair fall. Cancer medications are a very common cause of hair fall. Then there's age related hair thinning. There can be thinning and hair fall related to your hairstyles. If you make a very tight hairstyle, you're going to lose hair on the front of your hairline. Similarly, you color your hair very frequently, you bleach, you use heat treatments, that's going to cause hair fall. So many causes.
Right. So, a number of things can result in hair
Absolutely.
fall. But the most important thing, I think, is to understand, doctor, that, because on an everyday basis, we lose some or the other hair. So, it's important to understand when the alarming situation is here, we need to go and seek the right advice from the right person who is a qualified dermatologist. So, how
Absolutely.
many hair, shedding is normal, doctor, and when we should be alarmed that okay, now this is not normal, we need to go and take help.
So see, according to textbooks, it said 50 to 100 hair strands a day is normal. But in a practical way, it's very difficult to count the number of hair strands you're losing every day. So a simple way to understand is whatever is your normal. If you're losing more hair than that, that is abnormal for you. Okay, and
Hmm.
if that persists for a very long time, then you should seek out treatment. Or if you're seeing visible thinning, or if you're getting patches of baldness, then again is when you should seek out treatment.
Right. So if something is not normal, you are shedding more hair than your normal, or you are seeing, pattern baldness or thinning of hair, please, please, please don't delay. Go and consult the right person again, which is a qualified dermatologist. Now, doctor, what
Absolutely.
happens? We all know that, and many a times we do experience hair falling, which is not normal. But then we'll first run inside our kitchen, start with something, start applying something on our hair. प्याज का रस लगा लिया, कुछ कर लिया, शिकाकाई, आंवला, रीठा. Home remedies, we are so obsessed with it. Then we have so many DIYs these days because we have so many influencers on various social media platforms, and their favorite topic is related with skin and hair issues.
Absolutely.
वो कर लिया या किसी फ्रेंड या रिलेटिव ने बोला ये कर लो, मैंने ये लगाया था, इट वर्क फॉर मी. And in that process of experimentation, we delay a lot, we waste a lot of time, and by the time we land up in front of a doctor, probably अगर पहले चले जाते तो शायद थोड़ा और easy होता. So my question to you, doctor, is that do these home remedies or over the counter, topical applications which we get because market again is flooded with products, or these DIYs, do they really work, or we need to go and consult the specialist doctor at the right time as soon as we start spotting these abnormal shedding of hair?
Okay, so again, coming to home remedies, this is very subjective, right? For some people, like I told you, there's a self-limiting kind of hair fall which is stress related or post some illness. So for those kind of people, they'll put anything in the hair or they'll not put anything. That kind of hair thinning, hair fall will resolve. Right. So, but nowadays you are seeing these home remedies. There's so much hype about rosemary oil, but honestly,
Mhm.
there's no literature surrounding all this. Whether it's your onion juice, your rosemary oil, or any kind of oiling for that matter, they have not found to be helpful. There's no quality literature when we compare it to your standard treatments like minoxidil and other medications. So, if you want to seriously treat your hair fall, you should definitely see a specialist. You should get investigated. We should look into the cause of hair fall and treat it accordingly. Home remedies don't really help. They cannot objectively help everybody with hair fall or hair thinning. And all these over the counter products, I don't understand the concept of anti hair fall shampoo, because how can a shampoo help with hair fall? It's beyond me. So again, no literature backing that. Even over the counter hair serums, it's like shooting an arrow in the dark. You don't know the cause, you're just applying something externally. What if the cause is internal? There is something,
Right.
some deficiency in the body. Till we don't correct that, the hair will not grow. So depends on how serious you are about treating your hair fall. If you really want results, then a result driven approach can be provided with a doctor or a dermatologist after assessment.
Right. So it's important to diagnose. It's important to understand what is causing this hair fall. And for that, you need to go and consult the right person. And as soon as you go, I mean, before it's too late, it's always a good idea because it will be easier for even them to, understand the problem, try to resolve the problem, etc. Now, doctor, when a person comes to you with hair fall or hair loss issues, what are the tests that you normally recommend for proper diagnosis?
See, again, it depends on the person. It is very unique to the kind of hair fall, the kind of hair thinning. But obviously, a good place to start is a test called a trichoscopy. We use a specialized instrument which is found with dermatologists, and we're able to magnify the hair follicle. We're able to look at the hair, the scalp. And I like to show my patients images also. Ki, look, this is what is going on. So you understand what is actually happening, what is the disease process. So we can, diagnose your patterned hair loss, we can diagnose stress related hair thinning. So trichoscopy is a good place to start. Then comes your blood tests, as and when needed. We want to look at your general nutritional status. Somebody with a very low hemoglobin, somebody who's anemic, will lose a lot of hair until we don't address that,
Right.
low hemoglobin. They are not going to respond. If it's iron deficiency, we want to look at your vitamin levels, your D, B12. We want to look at your thyroid. There's a multitude of tests, but again, it has to be customized to the patient. I can't tell you
Right.
get these tests, 10 tests done. They're going to be valid for everybody with hair fall. If somebody has hormonal hair thinning, then we get a hormone profile done, you know. So we have to figure it out on a case to case basis.
Right. And what are the treatment options available, doctor, plus the procedures?
Okay, so obviously treatment of the underlying cause, and aside from that, we have to. There are topicals. There is medical treatment. In topicals, we use minoxidil. Minoxidil is one of those proven molecules. In fact, all those home remedies that we were talking about, they have all been studied against minoxidil because minoxidil has established efficacy. So this is one of our go-to molecules, my go-to molecules when it comes to certain forms of hair fall. Then there are also topical peptide formulations which are effective. Coming to oral medications, we have a lot of options now. There is oral finasteride, oral minoxidil, there's spironolactone. Multitude of oral medicines also, again, have to be customized for the patient. Okay. Sometimes we also have autoimmune conditions which cause hair fall. So, alopecia areata is a very common one. In that, what you see is patches of baldness, patches of hair loss. It can affect the scalp, it can affect the eyebrows, it can affect the beard in men. So, in that case, obviously, it's a completely different approach towards treatment. Then in that, we have to use some form of oral medicine, some creams to apply. Then, coming to general hair fall, your pattern, then post-stress procedure-based management is also there. We make like it's a customized treatment, where we are doing PRPs, we are doing GFCs, there is mesotherapy. So talking about PRP, platelet-rich plasma therapy. So in simple language, what we are doing is we're extracting a little bit of blood, we are processing it in a machine, and we are getting hold of some of the platelet-rich plasma. Platelets contain a lot of growth factors. So we give that to the hair root, the hair follicle. And those growth factors again stimulate good hair growth, improvement in density, new hair growth. So that's an excellent procedure to go for aside from medical treatment.
Doctor, as you mentioned before, that family history also plays an important role. So, in case there is a family history, and in case the person, for example, there is a family history with the father, grandfather, etc., and of course the son is at risk, what can he do to prolong, at least, if not prevent that, prolong, or at least save the maximum amount of hair on his scalp? Is there a way?
Okay, so we are talking about the patterned kind of hair loss or androgenetic alopecia, which is also seen in women. We call it female
Right.
patterned hair loss. So the genetic history is very strong with this. It's related to your hormone profile. We can't always prevent it completely, but yes, we can delay the onset. Now, when are you going to get it? Aside from the genetic factors, it is also dependent on how healthy you are, your overall health, your lifestyle. So, somebody who's a smoker, somebody who has a very stressful lifestyle, doesn't have adequate sleep, they are going to have an earlier onset of this kind of genetic hair thinning versus somebody who takes good amount of proteins, who has a good nutritional profile, doesn't have deficiencies, your iron, your vitamin D, B12, all of these deficiencies have been taken care of. You exercise regularly, so these are factors which play a role in deciding when your thinning is going to start.
Right. Doctor, as you also mentioned that, your diet plays a very important role in keeping your hair healthy, keeping your scalp healthy. Now, what should our thali, consist of? What are the things that we should, especially with those who are, encountering hair loss, hair fall on a daily basis and is worried? What should we do?
Okay, so obviously it has to be a balanced diet. You have to have the major food groups, you have to have your protein, you have to have carbohydrate, you have to have fats, everything has to be there. But primarily for hair, because hair is nothing but keratin, which is a form of protein, you do need to have an adequate protein intake. So for somebody who's non-vegetarian, who takes a non-vegetarian diet, your chicken, your fish, these are good sources of protein. For somebody who's vegetarian, your dals, your paneer, your dairy sources, chana, besan, these are really good sources of protein which need to be included in your diet. Secondly, again, we want a good vitamin and a multi-mineral profile. So a lot of fresh fruits, fresh vegetables are a good add-on to your diet. And yeah, that's But for things like vitamin D, because that is synthesized in sunlight, and most of us don't get adequate sun exposure. So because of that, it is best to get investigated and supplement that.
Mhm.
Uh, Iron deficiency is also a very common cause of hair fall. So, you want to look for good iron sources aside from your animal sources. There is pomegranate, there's beetroot, there's apples. These are good sources of iron, which you should
Right.
include in your diet.
Fair enough. I'm getting so many questions. There is one question by Kiara Chauhan. Her question is the hair transplant effective for hair loss? How effective is hair transplant?
Okay, so again, hair transplant is not a decision a patient makes. This is
Hmm.
for a doctor, for your treating dermatologist to recommend to you that, look, you're a good candidate for transplant, you go for it. Now, what makes you a good candidate? Obviously, there are many things, but a basic idea you need to understand is you have to have a defined hair loss or hair thinning. If it is very, very early pattern baldness, then you're not a good candidate for transplant because वो hair thinning progress karega, then your pattern will change. You'll have to go in for another transplant couple of years down the line. So that is
Yeah.
one thing. Second is, what is your donor area like? Because in transplant, we are doing nothing but we are taking the hair from one place and we are placing it to the affected area. So you have to have a
Hmm.
healthy donor area. Thirdly, what is your overall health, overall well-being like? Somebody who's old or somebody who has a lot of comorbidities, yeah, wound healing अच्छा नहीं है, diabetic है, uncontrolled है, we wouldn't want to do a transplant in somebody like that. So, best to see a dermatologist, get a proper assessment, and then decide whether or not you're a candidate for transplant. And also, with transplant, it's a surgical procedure, so accordingly, the risk assessment has to be done.
And how important it is to get these procedures done under the supervision of a qualified dermatologist, because crackery is increasing rapidly. Then we have these salons, various other clinics also who claim to do these procedures.
So I cannot stress on how important this is because the minute you're injecting something into your body, whether it's the skin, it's the scalp, it has to be done under aseptic precautions. And I don't know how they maintain asepsis in all these salons. It's just not possible. In fact, we heard about these few cases of people who became HIV positive because they were getting PRP at a salon in Mexico. So that it is so important that you are going to a qualified dermatologist. You have to always check who you're going to, what are their qualifications, what are their degrees, and what does the place look like.
Hmm.
It has to
So
be
all the
done under complete
equity,
aseptic
and in
precaution.
case you are
The
going
person
right.
treating you has to know what they are doing. It is very easy to say, अच्छा आपको hair fall है, आप PRP का package ले लो. But that is not how treatment works. It's a science, it's medicine. You have to start from the basics. You have to customize a treatment plan for the patient. It's not just PRP करा लो सबका hair fall ठीक हो जाएगा, because that's what we see these days, thanks to all the quackery around.
Yeah.
So super important to choose your doctor carefully, and that is what will decide how much of a result you're going to see.
एब्सोल्युटली ऐसे में किसी और ऑर्गन से रिलेटेड चीज होती है, अगर मान लीजिए हार्ट सर्जरी है, किडनी ट्रांसप्लांट है, या कुछ भी और है, किसी और ऑर्गन से रिलेटेड इशू है, then we will prefer going to the specialist, right? In case of heart, we'll go to a cardiologist. In case of kidney, we'll go to a nephrologist, etc., etc. लेकिन स्किन है, स्कैल्प को लेके शायद थोड़े हम lenient हो जाते हैं, which is not a good thing. You need to
Yeah,
go to the right person, the right specialist, which is a qualified dermatologist. Please check their qualifications, etc. वो normally
absolutely.
disclosure रहता ही है. So that's really important. Abhi Kumar is here, and his question is, how can scalp infection affect hair?
Okay, so definitely see any kind of inflammation that is happening on the scalp, whether it is folliculitis, you are having some bacterial infection or a fungal infection, any inflammation will cause the hair to fall more. Okay, and secondly, any kind of infection or inflammation is going to cause that urge to scratch the scalp. आपको you'll want to scratch it. So because of that scratching also, that physical trauma will also cause the hair to fall out. So aside from your infections, there's something called seborrheic dermatitis, जो हम common language में dandruff बोलते हैं. That is thanks to a fungus on our scalp called malassezia. That is again an inflammation of the scalp, which is itchy. So you scratch, you have inflammation, you're going to lose the hair.
Right. Right. So, and because you just spoke about dandruff, which is again quite common in our society. Now, the thing is, as you were also mentioning before, that oiling is not a very good thing, or oiling doesn't promote hair growth. But then we are again so obsessed with oiling of scalp and will keep the oil for hours, hours, and hours. We feel that the more number of hours the oil is on our scalp, the more better. Please burst the myth if at all it's a myth.
Absolutely. Patients are so shocked when I tell them oiling is not helping your hair growth. At
Mm.
best, the massage, the scalp massage that you do helps with blood flow to the hair follicle. So that may help a little bit, but the trade-off is not worth it because oiling up scalp में oil बहुत देर लगा के छोड़ रहे हो, you're leaving it on for a long time. That's going to promote dandruff because oil usually acts as food for that fungus I talked about. So we don't want to oil the scalp. It's not doing anything for you. So at the most, for some patients who really insist, we love our oil, we have to use it, I tell them you apply it to the strands and just wash it off in 15, 20 minutes. Don't leave it on. It's not helping you in any way.
Right. So, oiling is definitely not a very good idea.
Yeah, it's a
Especially,
little
it's
bit
not
of a
good for
it's a little bit of a
hair.
shock because we've been taught, it's been ingrained in
Yeah.
me that oil massage is so good for us. It's so healthy for our hair. No evidence.
Right.
Yeah.
Again, no evidence. Now, doctor, because we are talking about hair fall and management of hair. Some people are so scared to wash their hair regularly because every time they go under the shower, they feel that a lot of hair is shedding. So they don't know how often to clean your scalp, how what kind of cleanser or hair wash to use, what kind of conditioner to use. Would you like to throw some light over that?
Okay, so this is obviously it's a misconception. It's a myth. Ki if we wash too much, our hair is going to fall more. Whatever hair has to fall, it will anyway fall. And if you don't keep your scalp clean, your hair is going to fall out more. So we want to
Mhm.
keep the scalp clean. And as far as frequency of washing, how often we should wash in a week depends on your scalp and your hair. So if somebody has is very sweaty or they work out very frequently, scalp gets very oily, scalp gets very sweaty, you need to wash more frequently. Somebody with normal scalp may wash say twice a week. Twice a week is a good number to wash for most people, but for somebody whose scalp gets very dirty, wash it more frequently. For somebody who has textured hair, curly hair, or dry hair, or you've had treated hair, you have colored hair, you take a lot of heat treatments, and your hair is dry. You want to wash less frequently, and usually a gentle shampoo is adequate. You should follow it up with a conditioner post wash. Conditioner is what basically moisturizes the strand since the hair is dead, there is no kind of moisture coming to the hair strands, so you have to give it that moisture externally, and conditioner does that for you. So it's a great idea to follow up your shampoo, because shampoo is for the scalp, conditioner is for the length of the hair. A lot of times people don't know that, they're shampooing the length of the hair. You just need to shampoo your scalp. So yeah.
Right. So shampooing is for the scalp and conditioners are for the length of the hair. So apply that
Absolutely.
purely. Better. As we are talking about hair management, and now you earlier also mentioned that these, so-called hair treatments, hair straightening, hair rebounding, keratin treatment, etc., etc., plus using of these hot iron rods or straightening your hair on a regular basis, blow drying, etc. They are now like an integral part of our lifestyle. How harmful it can be, we all know, but then how to, because we can't go without them, right? So they are now so important. But what precautions we can, take to minimize the damage?
So honestly, if it's any kind of heat treatment or any bleaching is involved, I don't recommend it as a dermatologist because it's going to damage your hair. In fact, there is a condition which is really fascinating. It's called bubble hair. I don't know how many people know about it. So what happens is if your hair are wet or there's moisture in the hair and you use a straightening iron or you do some heat treatment to the hair, so that hair which is present, that moisture which is present in the hair, it becomes steam and it expands. Okay, we look at it under the microscope, it causes something called bubble hair. So with that single session of, say, straightening your wet hair, you're going to get bubble hair. Bubble hair feels really rough. It feels very dry. You are like, मेरे hair damage हो गए, and it is irreversible. The only thing you can do is cut those hair off. So that is how
Mm.
harmful this thermal damage can be to the hair. Aside from that, you are losing moisture from the hair the minute you are applying such high heat. You are damaging the hair structure also. So
Right.
you are going to see things like split ends, hair will be more brittle, it will break more easily. Hair will fall out more, it may fall out in clumps also. So not
Mm.
recommended. But if you have to do it, then again for heat treatment, especially you have these heat protectant serums which do tend to help to a certain extent. And if you're blow drying, you blow dry very frequently. Use the lowest setting. Okay, the
Oh,
cooler the better. We don't want very high heat settings. If you're somebody who's very fond of making hairstyles, don't carry very tight hairstyles because that traction, that pull on the hair front of the
mm.
hairline, the hair root, that causes a lot of damage. Traction alopecia, it's a scientifically proven condition which we see very frequently. And with hair color, there are certain bond repair treatments which you can do weekly at home, which can kind of help improve the hair quality a little bit. But these heat treatments, bleaching, best avoided if you want to keep the hair healthy.
Yeah, right. And Doctor, before we wind up the whole session, any take-home message for our viewers?
So, just be gentle with your hair. Be as gentle as you can be. And if you have hair fall, don't stress about the hair fall. See somebody qualified and treat the hair fall because your stress will worsen the hair fall. It becomes a vicious cycle, you know.
Right.
So, seek treatment. Don't delay it. There are certain conditions in which early treatment will give you better result. And just be as gentle as you can with the hair. Right?
Yeah, right. So please be gentle with your hair, and in case of any issue or problem related with scalp, hair, skin, please go to a qualified dermat. Thank you so very much, Dr. Mriganka Mehra. It was wonderful talking to you. Thank you for your valuable time and making this session so informative. Thank you so very
Thank you for having me. Thank you.
much. Thank you, Doctor and viewers. Thank you for your excellent participation. Stay happy, stay healthy, and take good care of yourself. Have a great evening ahead. Goodbye.
Thank you.